angioneurotic edema, it affects the dermis, means the layers of the skin. The dermis, the layers below the skin also. Even up to the submucosa and mucosa also it affects. And it affects the whole body. And there is a high possibility that even the voice box or larynx may be affected. So in this video, I will be discussing about angioedematic edema when it affects the larynx. So what happens is, in the body, in our body, there's a system called complement system from C1 to C9, as you see in this. This complement system, it fights against any foreign body like allergy or any food material which doesn't suit the body, or bacteria, virus. It fights against it by releasing some chemicals. Starting from C1, it gets activated up to C9. But usually, it is in the inactive form. It is kept in the inactive form by the presence of C1 esterase inhibitor. In this condition, angioedematic edema, the C1 esterase inhibitor is absent. So what happens? The complement system is active always. So any mild infection, immediately it activates the whole complement system and associated system, and the chemicals are released. And it can damage not only the foreign material which is entering the body, even our normal body parts, it gets affected. That's what happens. So either the C1 esterase inhibitor enzyme may be absent, or it can be of low level, or it can be defective. It can be either of these. Anyway, in short, the C1 esterase enzyme is not functioning normally. So we can classify into two types: hereditary type and non-hereditary type. In the first one, hereditary type, what happens is the C1 esterase enzyme is absent. The second one, again we have type 1 and type 2. I'm not going into the details. To classify, to put it in a simple words, it can be immune or non-immune. Immune means it can be related to allergy. Now the presentation. I'll show you one picture. See this picture. The patient, usually they say they have taken something, or they had slight fever and suggestive of infection, and immediately the whole body, it started swelling up slowly, especially around the eyes and the lips, and the whole skin is itchy, and it is keep on increasing. Now, if the larynx is involved, there will be change of voice, and there will be breathlessness also. And if left like that, it slowly increases, and it can result in stridor. The patient will not be able to breathe, and whenever they breathe, they have a particular sound. So when we examine the patient, other than all the findings which I have already told you, the heart rate will be more, the respiratory rate will be more, and when the larynx is involved and it keeps on increasing, then the oxygen saturation comes down, and patient will be in stridor. So immediately we will do a flexible laryngoscopy, and we will find out how much is the larynx involved. The findings usually are the congested laryngeal inlet and the vocal cords are swollen up, and the air passage is very less. It's compromised. So the tests required are CBC and C-reactive protein, which gives a hint whether it is because of allergy or it is secondary to infection. Likewise, see, if you do serum tryptase test, if it is increased, that means the cause is allergy. For a specific diagnosis, we want C1 esterase inhibitor, quantitative analysis. Usually this is decreased or effective. Now coming to treatment. The usual presentation I have told you, it starts slowly with body swelling and affecting the face, and there will be swollen lips and all, and slowly the patient getting cough and all. But there may be conditions like the patient, because of breathlessness, the treatment not given the proper time, because of breathlessness, the patient even collapsed, and they brought to the hospital in unconscious state. In that condition, we need to do an emergency intubation, and sometimes the anesthetist will not be able to intubate because of the swelling in the larynx. In that case, the ENT specialist will go ahead and do a tracheostomy. Let us see the usual scenario. where there is breathlessness but not that severe, and the patient has got other complaints. So in that case, if it is of the hereditary type, so we'll start with oxygen inhalation, IV fluids, and the patient needs C1 esterase concentrate. Since it is not available in every town and every city, it's available only in specific higher centers, the alternative will be fresh frozen plasma. Research are going on where they have said that they have proved that kallikrein inhibitors and bradykinin receptor antagonists can also be helpful, but at present it is not in the market. Now coming to the second variety, non-hereditary type of the immune type, allergic type. In that case, in addition to oxygen and IV fluids, we will start with adrenaline subcutaneous and IV steroids, and along with that injectable antihistamines also. Once it subsides, after the observation period, it becomes normal, we'll give him a few advice and we will discharge the patient. That's how we manage a case of angioedema larynx. Thank you so much.